So we were doing skin infections. Next topic is common viral infections that can involve skin. First of them is herpes simplex, infection due to herpes simplex virus. What is the presentation of a skin infection that is caused by herpes simplex? Herpes simplex type 1 and type 2, both of them can cause herpes simplex infection of the skin. The presentation is usually multiple vesicles on erythematous base. So you can see this, that there are multiple vesicles that are present on an erythematic base. It may cause fever, lymph node enlargement, and burning pain. So multiple vesicles with burning pain on erythematous base, your diagnosis will be herpes simplex infection. Type 1 infection is more common. And if someone develop an infection with type 2 herpes simplex, then type 2 herpes simplex, it can cause recurrent infections. The sites of formation of these vesicles, they can be lips. When it's around the lips, then it is known as herpes labialis. And if the lesions are on the genital area, then it is known as genital herpes. And if it's on the finger, then it is known as herpetic whitlow. So herpes simplex can cause a skin infection that will present to you with multiple vesicles on erythematous base and burning pain. And there will be fever and lymph nodes involved. So systemic signs and symptoms will also be present along with the formation of vesicles. And depending upon the sites of these infection, they can be called herpes labialis, herpes teres, and herpetic whitlow. And some points about herpes and pregnancy that we discuss in gynecology and obstetric chapters. That oral acyclovir is given, and if there's any active lesion at the time of delivery, a cesarean section is done to prevent the transmission of herpes virus to the baby. The second skin infection that can be caused by herpes is eczema herpeticum. We have already discussed eczema herpeticum, that as its name indicates, eczema herpeticum occurs in someone with a history of eczema. There will be clusters of intense itchy blisters. Punched out ulcers with crusting will be seen in the children with a history of eczema herpeticum. The treatment of viral infection is oral or IV acyclovir. Now, if someone develop an infection with herpes virus, more specifically human herpes virus 3. So herpes simplex virus result in the formation of an infection of the genitals or of the area around the mouth or lips, while herpes zoster is caused by human herpes virus 3, also known as varicella zoster virus. Varicella zoster virus can cause chicken pox during the childhood, and when the infection is resolved, this virus lie dormant in the sensory nervous system. So during childhood, a child will get infection with varicella zoster virus or human herpes virus 3. Then when the infection is resolved, this virus goes into the sensory ganglions and then sleep there or lies dormant in the sensory nervous system for years. Then during the lifetime, it can be reactivated due to immunosuppression and result in the formation of herpes zosters. Herpes zosters basically is eruptive skin lesion and pain in one particular dermatome. So one area of the body will be involved. You can see that it is most common on the trunk. This person has this localized vesicles in the lumbar region on the back. So this is known as herpes zosters or shingles. So the cause of herpes zoster or shingles is reactivation of the dormant varicella zoster virus that usually lie dormant in the sensory nervous system, and then it become activated due to immunosuppression. Usually there will be a band-like distribution. So the clincher or the important diagnostic point for shingles or varicella zoster, herpes zoster, is a band-like distribution because one single dermatome will be affected. Painful rash with burning pain in a band-like distribution is known as herpes zoster. So sometimes the reason for reactivation is unknown, but re-exposure to the virus, immunosuppression, and drugs such as DMRAD and steroids, they can sometimes lead to the reactivation of this dormant varicella zoster virus and result in the formation of shingles or herpes zosters. What is single or herpes zoster? It is basically a band-like distribution of painful vesicular rash with burning pain. So you can see that all the infections that are caused by herpes viruses, the rash is usually vesicular rash, itchy rash, and there is associated pain as well. So a painful itchy rash, you will suspect herpes virus infection. There is a complication of herpes zoster, and that is post-herpetic neuralgia. This is the most common complication of herpes zoster infection. What is post-herpetic neuralgia? That a burning pain that lasts long after blister disappear. So after the disappearance of the blisters, the pain still persists. This is known as post-herpetic neuralgia. Remember that if there are shingles, what are shingles? Shingles are itchy vesicles that are painful. If they are found on the trunk, they are known as herpes zoster. If they are found around the ear and there is facial nerve palsy and vertigo, then it is known as Ramsay-Hunt syndrome or herpes zoster oticus. So shingles around the ear plus facial nerve palsy plus vertigo, our diagnosis will be Ramsay-Hunt syndrome or herpes zoster oticus. Similarly, if shingles are around the eye, then it is known as herpes zoster ophthalmicus. So if on the trunk, they are known as herpes zoster. If around the eyes, then it is known as herpes zoster ophthalmicus. And if around the ear and facial nerve palsy, then herpes zoster oticus or Ramsay-Hunt syndrome. So these are some variant of herpes zosters. Remember them as well. The treatment is antiviral agents such as acyclovir, famciclovir, valacyclovir if the patient present to you within 72 hours after the onset of rash. And if someone develop the complication of herpes zoster such as post-herpetic neuralgia, because it is a Nerve pain is involvement of the nerve which lead to this development of the pain. That's why the drugs which can be used for neuropathic pain can be used in post-herpetic neuralgia as well, such as amitriptyline, duloxetine, gabapentin, and pregabalin. So the treatment of Herpes zoster is antiviral agents, and the treatment of post-herpetic neuralgia is the medication which are used in the neuropathic pain, such as amitriptyline, duloxetine, gabapentin, and pregabalin. Remember that herpes virus can also cause encephalitis, and we have discussed this meningoencephalitis or encephalitis in the neurology chapter. So here you just need to remember that herpetic infection can be complicated by the development of encephalitis as well. So it is one cause of viral encephalitis, and the presenting features are severe headache, confusion, and seizure, etc. Post-herpetic neuralgia, we have already discussed what is post-herpetic neuralgia. Post-herpetic neuralgia is persistence of the pain even after the vesicles are resolved. The treatment is amitriptyline, gabapentin, pregabalin, etc. And the other advices that you can give to the patient, initially it can be treated with paracetamol. Also, painkiller, opioid painkillers such as codeine can also be used if there is no response with paracetamol. And drugs that are used to treat neuropathic pain, they can also be prescribed. What are the advices that you can give to the patient? Uh, you can you will advise the patient to wear loose clothing or cotton fabric. Protect the sensitive areas by applying a protective layer and frequent application of cold packs. So these are the general advices that you can give to a patient with post-herpetic neuralgia. Now we are all familiar with warts, that human papilloma virus can cause warts. We have discussed this as well in the genitourinary chapter. A short revision of the warts include that the warts are caused by human papilloma virus 6 and 11. They cause anogenital warts, and human papilloma virus 16 and 18. They are the risk factor for cervical cancers. There is a vaccine available in the UK for human papilloma virus, that is Gardasil. So the prevention of HPV is through Gardasil. The treatment of the wart is chirotherapy, laser or electrocautery or chiropotry. Any of the procedure can be performed to remove the warts. Now another viral infection that is known as Molluscum Contagiosum.
This infection of shingles, is there a specific age that it can happen, or it can occur at any age?
Yes, it can. The virus can be reactivated at any age.
Because usually the shingle injection is given at a specific age here in the UK, between it's like 71, 78. So
Old patients are at an increased risk due to the reactivation of this virus. And if shingles occur in old age patient, there can be many complication.
right.
So that's why shingle vaccine is given to the older population in the UK,
Okay.
because it causes a serious infection in elderly people.
Right.
In adults, in immunocompetent patient, It can only cause a vesicular rash, but old age patient can develop other complications such as encephalitis. So that's why they receive a shingle vaccine.
Okay.
So molluscum contagiosum is another viral skin infection that is caused by molluscum contagiosum virus, and a transmission of molluscum contagiosum virus can occur directly by close personal contact or indirectly via fomites such as contaminated towels, etc. The majority of the cases of molluscum contagiosum, they occur in children, with maximum incidence in preschool children aged between 1 to 4 years. So in short, molluscum contagiosum is caused by a virus, and it is common in children between age of 1 to 4 years, and it is transmitted directly and indirectly as well through contaminated surfaces. So what is the presentation of molluscum contagiosum? Molluscum contagiosum presents with characteristic pinkish or pearly white papules with a central umbilication. So this is an important point, that the papules of molluscum contagiosum, they are pinkish with central umbilication. Let me show you a diagram. You can see in these papules, this central depression in this one, in this one, in this one, and in this one as well. And in this diagram, you can see the pinkish appearance of the papules. So molluscum contagiosum presents with a pinkish or pearly white papule with a central umbilication or a central depression. These lesions appear in the clusters in areas anywhere on the body. They does not occur on the palms of hands and soles of the feet. So they does not occur on palms and sole. Other than these two areas, they can occur anywhere in the body. They are more commonly found on the trunk and on the flexors. Remember that in adults, sexual contact may also lead to lesion developing in on the genitalia, pubis, thighs, and lower abdomen as well. So in children, the common sites are anywhere on the body, especially on the trunk and on flexors, while in adults who has a sexual contact, they can develop the lesions on lower limb, genitalia, pubis, and thighs, etc. There is no treatment usually required for molluscum contagiosum virus because it is a self-limiting condition. It can resolve within typically within 18 months. Explain to the patient that lesions are contagious, and he should avoid sharing towels, clothing, and baths with uninfected people. Remember that someone with molluscum contagiosum, exclusion from the school, gym, or swimming is not necessary. So reassurance is only required because it's a self-limiting condition, and the only advice you will give to a patient with molluscum contagiosum is that he should avoid sharing towels, clothing, and bath with siblings. Usually, treatment is not required, but if the lesions are troublesome and if someone want them to be removed, then chirotherapy can be done to remove them. And if there is extensive itching, then emollient or topical corticosteroids can also be prescribed. When will you refer a patient with molluscum contagiosum? Someone with a history of HIV positive, and if there is eyelid margin or ocular involvement with red eye, then you will refer the patient to an ophthalmologist. And lesion in the anogenital region should be referred to genitourinary clinic. So patient with HIV will be referred to an HIV specialist, and if there is involvement of the eye, he will be referred to an ophthalmologist. And if there is anogenital lesions, then he will be referred to a genitourinary clinic. Otherwise, only reassurance will be provided to the patient that this condition is self-limited and it will resolve on its own. And if the lesions are problematic, then chirotherapy or simple trauma can be done to remove them. And if there's itching, then topical steroids or emollients can also be used. So a child with a rash on trunk for more than 1 month. This is the picture of this is his rash. Remember that there are usually 2 to 3 questions from dermatology that consist of pics. So that's why it's important to remember 1 or 2 differentiating features of different rashes, and also the appearance of different rashes is also important to remember, and also the location of the rashes as well. So a child with a rash on trunk for 1 month. This is the picture of his rash. So pink lesion, and the rash is more than of 1 month because molluscum contagiosum can take a long time to settle down. So this history, a rash on the trunk for more than 1 month and pinkish nodules on the trunk, most likely the diagnosis is molluscum contagiosum. So one important other point that is if they are squeezed with fingernails, they produce a cheesy or white material. They are common usually in children and in patient with AIDS. So if someone present to you, if an adult present to you with extensive pink implicated papules, then HIV screening is necessary, or you will consider a diagnosis of AIDS as well. So children or common in children, and if adult present to you with molluscum contagiosum infection, then you will do a screening of HIV. So we are done with the viral infection of the skin. I hope it's clear to everyone. If there's any confusion or any question, then you people can ask.
So the treatment for this molluscum contagiosum is not cryotherapy. We can't clear them with cryotherapy.
Chirotherapy will only be done if the lesions are problematic, if they are causing problem, or if the person is saying that they are unsightly for cosmetic reasons. then chirotherapy can be done. Because chirotherapy can be done only by a specialist and an expert, so that's why it's avoided. So the first line management is always reassurance,
Right.
because if a condition resolve in on its own within few months, then there is no need of the treatment.
Okay. So there is reoccurrence after cryotherapy.
No, there is no recurrence after chirotherapy.
Okay.
In NHS, usually any procedure that can be avoided is usually avoided. So if an infection can resolve on its own, then we usually do not treat those infections. Yesterday we discussed that gutted psoriasis uh, also does not require any treatment because gutted psoriasis resolve on its own. Similarly, in molluscum contagiosum, because it resolve on its own, that's why it also does not require any treatment. But if the patient want to get treated, then chirotherapy can be done. See, if the lesions are troublesome or considered unsightly, that they do not look good, if the patient say, I don't like them, or they do not look good, or they are unsightly, then chirotherapy or simple trauma can be done. How? Squeezing with fingernails or piercing the lesion may be tried first, following a bath. And treatment should be limited to a few lesions, one at a time. So we have two treatment options, either simple trauma or chirotherapy, depending upon the parent's wishes and the child's age. Because chirotherapy requires professional expertise and experience. That's why simple trauma can be tried first. Only when, if the lesions are troublesome or if they are considered unsightly, then the treatment is required. Otherwise, no treatment is needed. Any more questions? So we are done with fungal and viral skin infection.